Okay, welcome to section 16.1, which is going to be the first in a series of lectures in Anatomy and Physiology 2. So if you've made it this far, I'd like to congratulate you on getting past Anatomy and Physiology Part 1, and welcome you to join me through the sections that we're going to cover in Anatomy and Physiology Part 2. The first of those sections is going to be 16.1, where we talk about the overview of the neurological exam. In the subsequent videos following this for Chapter 16, I'll talk a little bit more in depth about the different parts of the neurological exam, but let's get a good overview of what it is right now. So basically, the neurological exam is a clinical assessment tool that doctors or nurses will use to determine if there's any parts of the central nervous system that might be affected by damage or disease. You can do it in a really short amount of time, which is important because if there is any damage to any part of the central nervous system, it's going to be important to establish the proper treatment right away, because if that damage is left for any sort of amount of time, the damage could be irreparable. And so the first part of the neurological exam is the mental status exam, and that's going to assess your higher cognitive functions like memory, orientation, and language. And then if you pass that, there's the cranial nerve exam, which is going to test the function of those 12 cranial nerves that we learned about very recently. And then once you pass the cranial nerve exam, we'll move on to the sensory and the motor exam, which, like the name suggests, tests your sensory and motor functions that are associated with your spinal nerves. And finally, the coordination exam will test your ability to perform complex and coordinated movements, including the gait exam, which will basically ask you to walk because that walking is a coordinated movement. And so what the neurological exam does in terms of neuroanatomy basically plays off of the idea of localization of function. And basically that concept just means that specific functions have specific locations in your central nervous system. And so, for example, when we talk about the cognitive functions like memory, orientation, and speech, those things are based in your cerebrum and basically in your cerebral cortex. So if you have any damage or you're unable to perform any of those three tasks, you know that we would be able to figure out that there's some sort of damage in your cerebral cortex. For one example is that in a majority of individuals, your language function is localized in the left hemisphere of your brain. And so if there's any sort of damage going on with your ability to speak or even understand language, we would know that we could start looking for the localization of the disease or the damage in that area. And so basically the rest of the exam plays off on this as well. So we just talked about the mental status exam, the cranial nerve exam. Well, we know that there are specific locations for the cranial nerves that perform specific functions. And so the cranial nerve exam looks at those nerves that connect to the diencephalon and the brainstem. Then the coordination exam and also the gait exam assess the functions of your cerebellum. And then the motor and the sensory exams are associated with the spinal cord and all of your connections that your spinal nerves make. Okay, and so basically I'm going to stop it right there. There's a little bit more information about what kinds of damage could happen, including strokes, either ischemic or hemorrhagic. But you can read that on your own. I'm not going to get too far in depth with it right now. And then look forward to the next video, which is going to go into chapter 16.2, where we go a little bit more in depth about what the mental status exam entails. So thanks very much, and I'll look forward to seeing you in the next one.